Doctor, good morning, madam. May I know your name, please? Patient, good morning. My name is Naya. Doctor, all right, Naya, can you tell us what brings you to the hospital today? Patient, well, I've been feeling very tired and weak lately. I've also noticed that my hands and feet have been growing bigger. How long have you been experiencing these symptoms? Patient, I would say it's been going on for about a year now. Doctor, have you noticed any changes in your facial features, such as enlargement of your jaw or forehead? Patient, yes, I have. My forehead has become more prominent. And Doctor, have you had any headaches or vision problems? Patient, yes, I have been experiencing frequent headaches, and my vision has been blurry at times. Doctor, have you noticed any changes in your menstrual cycle? Patient, no, I haven't noticed any change. Doctor, have you been experiencing excessive sweating or increased body hair growth? Patient, yes, doctor, I have a noticed increase in body hair growth and excessive sweating. Doctor, have you had any previous medical conditions or surgeries? Patient, no, I have not had any major medical conditions or surgeries in the past. Doctor, do you have any family history of endocrine disorders? Patient, no, I don't think so. Doctor, all right, thank you for answering our questions. Based on your symptoms and medical history, we suspect that you may have acromegaly, which is a hormonal disorder that causes excessive growth in the hands, feet, and face. Doctor, we will need to perform further tests to confirm the diagnosis, such as a blood test to check your hormone levels and an MRI to look for any abnormalities in your pituitary gland. Patient, okay, I understand. Thank you for your help, doctors.